Good day, sir. So this is my final exam for the video. So I am April Rose Arce, and here's my video of what I've learned through this semester about pharmacology. Okay, so let me start first the history of the history or um, the definition of pharmacology. So I've learned that pharmacology was derived from the Greek word for drug. It is also a science that studies drug effects within a living system, biochemical and physiological aspects. It also deals with all drugs used in society today, legal or illegal, including street, prescription, and non-prescription or over-the-counter medication. So, pharmacology is divided into two main subdivisions. According to this lesson, it has these two main subdivisions is the pharmacokinetic, which is it is the properties describe the actions of the body of the drug, including absorption, the distribution, metabolism, and excretion or elimination. The second one is the pharmacodynamic. It is the properties of a drug describe the action of the drug of the body, including receptor interactions, dose response, phenomena, and mechanism of therapeutic toxic action. So, this recent lesson that you give to us is all about antibiotics. So, what I've learned about it is that antibiotics are medicines that fight bacterial infections in people and animals. They work by killing the bacteria or by making it hard for the bacteria to grow and multiply. Antibiotics also can be taken in different ways. It can be orally or by mouth. This could be pills, capsule, or liquids, or by injections. Um, um, there are, according to the lessons that you gave to us about the antibiotics, there are top 10 list of antibiotic classes or types of antibiotics. So, first is the penicillins, tetracyclines, cephalosporins, quinolones, lencomycins, macrolides, sulfonamides, glycopeptides. So those are the top 10 list of antibiotic classes or types of antibiotics. So I also learned about the pre-administration assessment, or I didn't familiarize that topic, but sa ako lang nahinumduman is ang pre-administration assessment is a collection of baseline data needed to evaluate therapeutic effects, and it is also collecting some baseline data needed to evaluate adverse effects. Also, the data needed to evaluate identifications of high-risk patients. It is also the assessment of the patient's capacity for self-care. So, there are also when it comes to prescription, there are part of a prescription which is the descriptive information about the client. It will be include the name of the client, the address, and sometimes the age. Also the date with on which the prescription was written. And then the top list that I've learned about this topic is the 10 rights of drug administrations, which is right patient, right medication, right dosage, right route, right documentation, right client education, right to refuse, right assessment, right evaluation. So that was the um, 10 rights of drug drug administration. So I also learned about the um, drug IV calculations. So as I remember, there are types of IV fluids, which is the isotonic and the hypotonic and the hypertonic. So for the isotonic, it is the IV solutions that have the same concentration of solutes as blood plasma, while the hypotonic is the solutions that have lesser concentration of solutes than plasma. And lastly, the hypertonic. It is the solutions have greater concentration of solutes than plasma. So far, that was the lessons or topics that I've learned throughout this semester. So those are the topics that I am familiar with, and hopefully na I can still remember it until I can use it for the future. So that's all, sir, and God bless.